Welcome to your chapter over types of health policies. Most of us are used to like a major medical policy where you have one policy that covers everything. Now, we're going to talk about major medical in a moment, but first we need to talk about some basic medical expense policies. I'm going to talk about two policies here. Uh, think of these policies as like a supplemental policy, like an AFLAC type policy, something that you would have in conjunction with a major medical policy. By itself, not really going to do you a whole lot of good, but in conjunction with major medical, it could be very useful. So once again, there's going to be two of them that we will talk about. Let me talk about some of the characteristics real quick, though, that you're going to need to know on this basic medical insurance policies. First, these policies provide what's known as first dollar coverage. This term, first dollar coverage, you will need to know for your test. All it means is there's no deductible. They start paying from day one. So first dollar coverage means no deductible. Now, all of these policies, since they are limited policies, limited benefit policies, they have limited protection. So most of the time, they have very low dollar limits. Once again, they're not designed to last very long by themselves, not going to do you a whole lot of good. So now let's look at each one of the policies that I want to talk about. First is a basic hospital expense policy. Another name for that is a hospital indemnity policy. The word indemnity or indemnify means to make whole again. When you purchase a basic hospital expense policy, once again, it provides first dollar coverage, which means no deductible, starts paying from day one. Now, it is a hospital expense policy, so you have to be confined to a hospital. It will pay a specified amount per day for your room and board while you're confined to the hospital. Now, this policy pays you. It does not pay the hospital or the doctors. This is money that's coming to you. But it's a specified dollar amount per day, unrelated to any of the other expenses you're incurring in the hospital, and does have a limited number of days that it will pay. So once again, not designed to last very long. Your next one is a basic surgical expense policy. Obviously, based on the name, it's going to pay for surgeries, so cost of surgeon services, including the anesthesiologist operating room when not covered as a miscellaneous item. There's some terminology here that I want you to be familiar with. First, they use what's called a surgical schedule. The surgical schedule will list procedures that are covered under that policy. If your procedure is not listed on their surgical schedule, then it is not going to be covered. Next, they use what's called a relative value approach. What that means is that each procedure on that surgical schedule is going to have points assigned to it. The number of points assigned to any given procedure will be relative to a number of points assigned to a maximum benefit. So think of it like this. Think on the surgical schedule that the most severe complicated surgery is going to be at the top. And let's say it's open heart surgery. Well, then every procedure below that gets a little less severe, little less severe, little less severe. So let's say open heart surgery has 1,000 points assigned to it. Well, every procedure below open heart surgery is going to have points assigned to it, but the number of points assigned to any procedure below that will be relative to the number of points assigned to that maximum benefit of open heart surgery. Okay. Next, there is a conversion factor, and the words in your book are important. The conversion factor represents the total amount payable per point. So let me just kind of give you a quick thing here on this. So let's say you had open heart surgery at the top, and it had 1,000 points assigned to it. And let's say they use a conversion factor of 10. So open heart surgery, 1,000 points, multiply that times 10, it means it would pay you $10,000 for open heart surgery. Once again, this is money coming to you. It's not going to the facility. Now let's look at that. Open heart, you have to have open heart surgery. 1,000 points assigned to it, going to pay you 10 grand. Is that going to be enough to cover open heart surgery? Well, obviously not. That amount of money barely going to get you in the hospital these days. Once again, that's why these are supplemental type policies. and they're not really good for everyday needs, but in conjunction with a major medical policy, they could be very useful. Okay, so those are your two basic policies that I like to talk about for your test. Now let's contrast that to major medical. Now, major medical, you have one policy that covers everything except for those things that are specifically excluded. Every policy has exclusions. We'll talk about those later on. Now, there are some moving pieces to a major medical policy. First, there is a deductible. The deductible is the amount you pay before there's any cost sharing with the insurer. So these do not provide first dollar coverage. You've got to pay a deductible first. Next, there's coinsurance, which is a percentage of cost sharing. Major medical policies have a stop loss feature, which is where you quit paying and the insurance company takes over 100%. And then it used to be they had a maximum benefit of, say, like $1 million or $2 million. Well, one good thing about the Affordable Care Act now is that major medical policies are unlimited on their coverage. So you adjust any one of these things, especially the deductible, the coinsurance, or stop loss, that will affect the premium or the amount of money that you are paying for that policy. So first, major medical, more comprehensive than basic policies. The deductible, the amount the insured pays before any cost sharing. Deductible will go anywhere from $500, $1,000, $2,500, or $6,000. Thank you, Affordable Care Act. Now, after you have met your deductible, then comes the coinsurance, which is the percentage of cost sharing. That's where you get your 80-20, 70-30, 90-10, and 50-50, for instance. So after you've met your deductible, and this is important for your test if you're unclear on how this all works. First, you've met your deductible. Then let's say you have 80-20 on your coinsurance, which means the insurance company is going to pick up 80% of your expenses after the deductible. You are going to have to only pay 20% after the deductible. So the insurance company is the number on the left. You are the number on the right as far as the percentage of expenses that are paid after the deductible has been met. Next, there is a stop loss feature. That's where you've reached your out-of-pocket max and are no longer billed for your medical expenses, which means the insurance company takes over 100% after the stop loss has been reached. And like I said a minute ago, major medical policies are now unlimited on their coverage. They don't ever quit paying. And they provide what's known as blanket coverage, which means you only have one policy that covers everything. You don't have to have a whole bunch of separate policies. One other thing I want to go ahead and throw in here about your health policies is because of the Affordable Care Act, the dependent child age limit has been raised, and now dependent children can stay on their parents' plan up to age 26. Okay, so dependent children can stay on their parents' plan up to 26, or even after 26 if they're still dependent upon somebody for support. We'll talk about that later. There are supplementary major medical policies. A supplementary major medical policy, all that means is that once your basic policy runs out, then you could have a supplementary major medical policy that would kick in. The one test question you might have about supplementary major medical policies is that there's a special deductible that would have to get satisfied, and they call it a corridor deductible. And it must be satisfied before those major medical benefits will kick in. All right, now we're going to go into some different plans. I've got 3 of them here, and I'm going to tell you the words associated with each one. Let me go ahead and throw in here that your test is very specific on where these words are compartmentalized as far as your HMOs, your PPOs, and your POS plans. Remember, the test world is different than the real world. Now, some of you might, as we go through this, go, well, my plan doesn't work that way. Well, guess what? On the test, it doesn't. Okay, so the test is completely different. So I'll really point out some things that you need to know specifically through here. First, let's talk about health maintenance organizations, or HMOs. HMOs are all about preventive care. They encourage you to stay healthy through regular immunizations and checkups. They want to catch stuff early. All 3 of the plans, HMOs, PPOs, and POS plans, they are all called managed care plans. They're helping to manage your care. The whole purpose behind managed care is so that they can control their cost. Make sure you know that for your test. Managed care plans are all about the insurance company controlling their cost. Now, HMOs will provide their benefits in the form of services as opposed to reimbursement of the service of the doctor or hospital. Those doctors are just providing a service. And I'll talk more about that as we go through our different pieces here. HMOs are all about specific geographic areas. There are pockets of HMOs throughout the state. You must live within their specific geographic area to get service from the HMO. If you move outside of the area, that would be a reason for them to drop you. HMOs have a limited choice of providers. It's actually the most limited choice of providers between the three different plans we talk about. You must pick from doctors and hospitals on their list. Now, here's something that is test specific. A co-payment is a specific part of the cost of care. That's your $10, $20, $25, $30 co-payment that you pay every time you go to the doctor. So that is specific to HMOs for your test. The doctors within an HMO, let's first say you're going to get to pick your doctor from their list of providers. Your doctor becomes your primary care physician. Now, anytime the need arises for medical care, you can't just go see any doctor on the list. You must go through your primary care physician and get a referral. This is called the gatekeeper concept. You need to know the gatekeeper concept. The whole purpose of the gatekeeper, apologize there, whole purpose of the gatekeeper is to keep down cost of high-priced specialists. That is the whole purpose of your gatekeeper. HMOs operate on what's called a capitated basis or a prepaid basis. What that means is the doctors within the HMO get paid a set fee for each member of the HMO. Whether that member sees the doctor or not, that doctor is going to make the same amount of money. And once again, this gets back to HMOs provide their benefits in the form of services as opposed to reimbursement of the service of the doctor or hospital. Now, HMOs, remember, they're all about specific geographic areas. You've got to live within their specific geographic area to get service. However, you do need to know for your test, it's very important that HMOs must provide both emergency care and inpatient hospital care in or out of the service area. So if you have to be traveling across the state, you're outside of your service area and you get in a wreck and you have to go to the emergency room, your HMO has to cover you. Even if you get hospitalized, your HMO must cover you. Now, they're going to want to get you back to the service area as soon as possible, but HMOs must provide both emergency care and inpatient hospital care in or out of the service area. All right, that is your HMO compartment of words. Now let's look at PPOs, Preferred Provider Organizations. Now, PPOs, once again, are also called managed care plans. Now, PPOs differ from HMOs in that PPOs are called fee-for-service organizations. The doctors are getting paid a fee for the service they are providing. So, fee-for-service organizations. So, PPOs are going to be about reimbursement. Okay, remember, HMOs are all about providing their benefits in the form of services, where PPOs are all about reimbursement of the service of the doctor or hospital. Now, PPOs also differ from HMOs. The PPOs have a broader choice of providers. You still have a list of providers, but it is going to be a broader choice than you would have in an HMO. Here is test specific. Once again, deductibles and co-insurance are a specific part of the cost of care within a PPO, and that is test specific for your test. Now, PPOs also differ from HMOs in that a PPO, you can go see any doctor on the list anytime the need arises for medical care. Okay? So you could pick a different doctor every day of the week. Now, on both PPOs and HMOs, let's say your favorite doctor is not on their list of providers, but you still want to see your favorite doctor outside of the list. What would you think would happen? Well, what's going to happen is obviously you're going to pay more, or your benefits are going to go down. So if you have a test question about somebody going outside of the network, look for paying more or benefits going down. All right, that's all I wanted on PPOs. Now let's look at a point of service plan, a POS plan. A point of service plan is merely a combination of an HMO and a PPO. So let me give you the characteristics for each. First, the HMO part. First, the doctors are paid on a capitated basis. Once again, they get paid a set fee for each member of the POS network. Next, you as a member would get to pick your primary care physician from their list of providers. But here's the PPO part. Even though you have a primary care physician, you can go see any doctor on the list anytime the need arises for medical care. So your primary care physician is not considered to be a gatekeeper. They are just your primary care physician, but you do not have to get a referral to see another doctor on the list. Now, let's say your favorite doctor is not on their list. You want to go see your favorite doctor outside of the network. All right. So here's what's going to happen. Number one, you're going to pay more, either through your copay, coinsurance, or deductible. And number two, and here's the key, the doctor you go see outside of the network will get paid a fee for the service they provide you. Okay, so for a test question, it's going to ask, how's a doctor compensated outside of a POS network? Just look for fee for service, and you will answer your question correctly. All right, next, let's look at some different ways to help you save for your qualified health expenses. I'm just going to talk about three of these, FSA, HRA, and HSA. So first, let's look at an FSA, a flexible spending account. A flex spending account is a form of a cafeteria plan. All that means is that you get to pick and choose what benefits you want from within the flex spending account. For testing purposes, there are two types of flex spending accounts. First, there is a healthcare account to help you save for your qualified healthcare expenses. Then there's a dependent care account to help you pay for dependent care expenses. You get to choose, do I want the healthcare account? Do I want the dependent care account? Or do I want them both? That's why it's called a cafeteria plan. Now, the IRS has set limits to how much money can go into each one of these accounts. You do not have to know the limits because they change every year. However, you do need to know if it comes down to the end of the year, any funds in your flex spending account, if you haven't used it, you lose it. So the flex spending account rule is used it or lose it. The money will not carry over. Now, on any of the other plans, the money can carry over each year and continue to accumulate, but not on a flex spending account. Now, it is pre-tax dollars that go into a flex spending account, so it does lower your taxable income for the year. Next, we have a health reimbursement account, or HRA. A health reimbursement account consists of funds set aside by an employer to reimburse an employee for their qualified medical expenses. It is the employer's money, so since it's the employer's money, the employer gets to set eligibility requirements, who can participate, full-time employees, part-time employees, or both. And they also get to set contribution limits, how much money can be set aside. It's their money, so they get to decide that. The benefit of that is it allows companies of all sizes to offer this type of benefit. So small employers can compete with larger employers as far as the benefits they provide. Next is a health savings account, or HSA. A health savings account consists of funds set aside by an employer and an employee, so it could be both of their monies that's getting set aside. Now, There are limits to how much can go in. You do not have to know the limits, but you do need to know that any money in a health savings account, if you use it for anything other than a healthcare expenditure, let's say you want to go out and buy a boat with that money, there is a 20% penalty plus tax on that non-health expenditure. Now that's only up to age 65. After 65, the penalty goes away and it's just treated like income. But make sure you know prior to age 65, 20% plus tax. Next, we have high deductible health plans. All right, this is really very easy for your test. All I need you to know is that your HRAs, your HSAs, and MSAs. MSAs are just medical savings account. All I need you to know is all three of those are linked to a high deductible health plan. So that if you have an employer with a high deductible health plan, you could use the funds from your HRA, your HSA, or your MSA to help meet that deductible.